Hi everyone, my name is Una Jojich White. I'm a master's student at Yorkville University and I'm a clinical practicum student at the Emotional Health CBT Clinic. Today I'm going to be talking about depression as part of the Dr. Michael Spevack Memorial Lecture Series. So in today's presentation, I'm going to discuss the definition, the prevalence, the causes, and the treatment for depression, and go over a couple tips, and we will have a question period. So, what is depression? The diagnostic criteria outlined by the Diagnostic Statistical Manual of Mental Disorders, so the DSM. We are now in the 5th edition, so the DSM-5 categorizes depression as a mood disorder. And in clinical language, we would call depression a major depressive disorder. So some of the symptoms here are listed here. Symptoms 1 and 2 are important, but I will get into that in a little bit. So the listed symptoms here, number 1 is sadness or irritability. Number 2 is experiencing a loss of interest and pleasure, perhaps previously experienced in participating in activities. Number 3 is an individual might experience weight loss or weight gain. They might also experience a change in their appetite. So feeling not hungry at all or feeling hungry more often than they had previously. Number 4 is insomnia. So having trouble sleeping, having trouble falling asleep, having trouble staying asleep, waking up repeatedly, etc. The opposite is also a possible experience, so hypersomnia. So sleeping for much longer periods, feeling like you are not getting enough sleep, spending much more time sleeping than an individual would have before. Number 5 is observable psychomotor slowdowns or increases. So observable would be somebody from the outside would notice this change. So either an individual is slowing down in their psychomotor functioning, or it's increased than their typical presentation. Number 6 is experiencing a lot of fatigue or loss of energy. So outside of sleeping, when the individual is awake, they may feel exhaustion or extreme fatigue, lack of energy to complete tasks or activities. Number 7, people may often feel worthlessness or a sense of guilt, inappropriate guilt, not triggered by a specific event or something like that. Number 8 is feeling like you have the inability to think or concentrate, focus, or make decisions. These things might feel quite difficult to accomplish, might feel overwhelming, or you may not have the energy or feel like you have the energy to complete that. And number 9 is individuals may have recurrent thoughts of death or of suicide. So for the diagnostic criteria, individuals need to have 4 out of the 9 previously listed symptoms. And here is the important bit where number 1 or number 2 must be part of those 4 symptoms that an individual is experiencing. So either an individual must be experiencing that sadness or irritability, or a lack or loss of interest or pleasure in participating in activities or tasks. So one of the four must be number one or number two, and then individuals can have any combination of the other symptoms. An individual must be experiencing these symptoms daily for a minimum of 2 weeks. So many of us experience bad days or bad weeks. However, we would not meet diagnostic criteria based on not always experiencing those symptoms for a period of 2 weeks or more. So, as with most disorders, there has to be a marked change from an individual's previous functioning, from their usual life. There needs to be a change that is significant. And the individual must be experiencing significant impairment in their functioning, so not functioning at the same levels as before, or some people experience and present normal functioning. However, they may feel they are putting in enormous effort to make that typical daily functioning. As with most disorders, we have to rule out other diagnoses. So for major depressive disorder, we have to make sure that this diagnosis and these symptoms are distinct from bipolar disorder, which would include episodes of mania, and dysthymic disorder, which would be a kind of consistent low mood. So, how common is depression? Over an individual's lifetime, about 10 to 25% of women experience depression over their lifetime, and about 5 to 12% of men will experience this. At one point, about 5 to 9% of women are experiencing depressive symptoms or episodes, and about 2 to 3% of men will be experiencing this. From what we understand, about 30% of individuals experiencing episodes or symptoms of major depressive disorder are seeking treatment. So there is a large group of individuals feeling like this, experiencing those symptoms, who are not seeking treatment for help. So how recurrent is depression? Does it keep coming back? Well, what we see is yes. So individuals who have experienced one episode, 60% of them will experience a second episode. Those who have experienced a second episode, 70% of them will experience a third. And for those who have experienced 3, 90% of them will experience a fourth episode. So the more episodes that you have experienced or an individual has experienced, the more likely that they will experience another. Individuals can feel or find remission in between episodes. So it may come in waves, and in between those waves of depression, they may not feel symptoms. So about 2/3 of individuals experience full remission in between episodes and return to their typical normal daily functioning. About 1/3 of individuals do not experience full relief of their symptoms. They experience partial remission. So they may have some of their symptoms that are still present. Some of those symptoms may be at lower levels of intensity during this time. However, they are not completely rid of some of those experiences and symptoms. What we see with CBT is that it is very helpful in preventing relapse. So preventing continuation of those symptoms, preventing another episode from occurring. So what are some of the causes of depression? Some of the factors we see here. So there are many individual differences. So there is an interplay of these factors. An individual's environment, their genetics, their biology, and their psychology all play an intertwined role in developing and experiencing these depressive symptoms and episodes. So in environment, an individual may experience a loss, um, a disruptive event that may lead to some of these symptoms. Genetics also plays a factor. In studies with relatives and twins, we see that um, identical twins, are more likely to experience depressive symptoms or episodes if their identical twin also does. And within first degree relatives, we see this also. So if you have a first degree relative who has experienced a major depressive disorder, you may be more likely to also have this experience. An individual's biology is also important. So one part is the the neurochemicals that are in the brain. So dopamine, serotonin, norepinephrine, these chemicals are play important factors in the onset of this. Also, the neuroanatomy of the brain, so the structure of the brain. There are parts of the brain that are involved in attention, emotional regulation, or production of emotions. And so if parts of these brains are underfunctioning, overfunctioning, understimulated, or overstimulated, that can play roles in this development of depression. An individual's psychology is also important. They may have a set of cognitions or beliefs about themselves, about others, about their world. Um, they may have sets of behaviors that also increases the likelihood if an individual often withdraws. This may contribute to these development in this way. So what are some of the possible treatments that we can offer individuals with this experience? So one option is antidepressants, so medications. So this would specifically target the neurotransmitters. So really the biology, the neurophysiology of the brain, the chemicals that I described, dopamine, serotonin, and others. There is a high success rate for individuals who take antidepressants. And so about 50 to 70% experience a positive response in reduction of their symptoms. However, the relapse rate of these symptoms and episodes is high, so about 60%. So the reoccurrence part of depressive disorder is still there. Cognitive behavioral therapy, so CBT, is another option. CBT targets an individual's thoughts, their behaviors, and their environment. The success rate is also quite high, similar to antidepressants, so it's about 67%. And here we see that the relapse rate is much lower than the antidepressant option. So like we said, cognitive behavioral therapy is quite effective in preventing symptoms from reoccurring or episodes from occurring again and again. So some of the components in cognitive behavioral therapy treatment is behavioral activation. So what I mean is getting an individual to engage in behaviors that lift their mood. Individuals may experience physical activity or socialization or quiet relaxation time as activities that lift their mood. So asking people to engage in them and participate in those activities. Number two is cognitive restructuring. So here I have a note about thought record, which is one exercise and tool that may be used in this type of treatment. So this is the goal here is to change an individual's unhelpful thoughts. And number three is experiments and practice. So here the goal is to test out some of these new assumptions that we developed when changing our unhelpful thoughts and really strengthening new positive core beliefs about oneself, about their world, and about their future. So, behavioral activation really means engaging. There are various components. So, one being mastery. So, feeling that sense of accomplishment, of task completion. So, cleaning the house, organizing something, or paying bills. We can feel a sense of accomplishment and reward once we've successfully completed these. And then there's engagement for pleasurable purposes. So doing an activity because it is fun, socializing with friends or family, perhaps going to a restaurant, a movie. Activities like this are helpful, and we want to encourage participating in those activities. So the logic here is do more of the things that make you feel good or that are pleasurable, and do less of the things that are contributing to making you feel bad. So, part of this is having to have realistic expectations for ourselves. We may not enjoy participating in an activity right away if we are experiencing depressive symptoms or an episode. Um, One of the symptoms is losing interest or pleasure in some of those activities. So it makes sense that it may not be as enjoyable as before. That's okay. Part of it is sticking through. Some of the other benefits is really challenging some of those dysfunctional thoughts and allowing for positive experiences and mastery. So the allowing for experiences of praise and reward that make us really feel good. Um, Activities can help distract us from some of those negative thoughts, like rumination, uh, continuously thinking about those negative thoughts, and distracting ourselves from that can be very helpful. Um, and it starts to limit some of the disruption in an individual's life. Where they may have withdrawn or avoided some of these activities, we are perhaps implementing those activities back in and returning to a more typical level of functioning and enjoyment in their day. Um, and physical activity can be very important because there are biological and chemical components with engaging in physical activity. So those neurotransmitters that we discussed in the antidepressants and the biology factor in depression are affected by physical activity. It boosts our mood and almost acts like a mild antidepressant in that way. So one component to CBT is the cognitive restructuring. So coming back to that thought record. So in a thought record, an individual may detail and explain a specific situation, how they experience moods in that situation, and perhaps what some of their thoughts were about it. Perhaps thoughts about themselves, about others around them, or about their environment and what it means. So the goal here is to target that thought and assess if it's something that's realistic, finding objective evidence for understanding if it is realistic or not. So do we have evidence to support that thought? Or do we have evidence that does not support that thought at all? Does it challenge that? Is it the opposite reality? So in that way, with finding evidence, we can generate and develop alternative thoughts that take into consideration that evidence. So we can perhaps develop a more realistic thought, a thought from a different perspective. So why is cognitive restructuring essential? So our mood affects our perception, our attention, our memory. We may be focusing on negative emotions or thoughts and committing those to memory more than perhaps positive experiences or rewards or accomplishments. Um, and our thoughts and our mood may not necessarily reflect reality. They may be the opposite. We may have cognitive biases or distortions in this way where mostly negative information is we are aware of instead of perhaps more positive thoughts or feelings. So we can have these cognitions about ourselves, about others, about our future. So about ourselves, we can be very self-critical. Some examples here is labeling. So labeling ourselves as ugly or useless or bad in some way. And really believing that that label is all-encompassing. We can be very critical or negative about others. We can have negative beliefs about others that perhaps they only care about themselves and others are less important to them and therefore they won't act in our interest. We can have these thoughts about our future. So feeling hopelessness is really about that individual's future. An example of this kind of thought is they will never get out of this rut, out of this feeling. This is just what they're always going to feel. So one way that we can challenge that is being your inner coach. Speaking to yourself like you would speak to a friend or a child. More likely you would be compassionate and understanding with that individual than critical and negative. We can use this self-talk to build up our self-esteem and self-confidence instead of tearing ourselves down. And being our inner coach means giving ourselves praise and rewards when we need them. So accomplishing tasks, no matter the size, big or small, is important and if we had an external coach, that might be their role in giving us praise for those things. So we can do that for ourselves too. One of the components is experiments. So there are some thoughts here that are examples that an individual might have. So one example is if I asked for a raise, my boss would get upset. And so this is a prediction of what's going to happen. It's a guess. This individual does not have the evidence to perhaps support that thought. So the goal would be to design and try out this experiment in some way and to really find out. So that piece is about finding the evidence for that thought. Did that experiment support or not support that thought? And so this evidence gathering needs to be objective. It needs to be concrete with concrete examples and responses from others or the environment. So it's not about another thought. It's not vague. It's something that we can describe and try again. And lastly, about cognitive behavioral therapy is about strengthening healthy core beliefs. So healthy beliefs about ourselves. And part of that evidence is keeping track of it and keeping track of it in the hopes of supporting healthy core beliefs. trying an experiment and finding evidence that I achieved something at work today. I achieved and accomplished that task. Um, and therefore I have value because of that. If you found enjoyment in an activity or in socializing, perhaps you were very supportive of a friend during a socializing activity, and you have value because you were a good friend and they needed your support and you could do that. So continuing finding the positives there and evidence for the belief that you have value. And so with depression, one of the symptoms is the reoccurrent thoughts of death or suicide. So suicide prevention is an important factor here to note. So about 15% of individuals who experience major depressive disorder do die by suicide. Some of the best predictors for somebody who may be experiencing suicidal ideation, so thoughts about suicide, is if an individual has a plan that they would enact, take on to complete a suicidal attempt. They may feel high levels of hopelessness, that there is nothing that will get them out of this, that there is no alternative. And if an individual has previous attempts, so that is a good signal that there needs to be suicide prevention for that individual, that they are likely to attempt again. So one way that we can target and enact suicide prevention with an individual is make a plan, have a contract, have steps to take, supportive people to reach out to, exploring what might help them, what makes them feel good, and having a contract for them to follow those steps. So that this can help with those feelings of hopelessness and counteract the plan that they might have imagined. And having that person see a professional, seeking professional help and encouraging them in that way. So we can help our loved ones. We can help our loved ones who are experiencing depressive symptoms or depressive episodes by being understanding, showing them empathy, that we want to be there for them. We can encourage them to participate in feel-good activities. We can engage in those activities with them also as an encourager. As social support, that you support them in this way. We can be their external coach at times. They may have trouble with being their own internal coach. So having an external coach can teach them that these are things they can do for themselves. So we can use praise and reward appropriately with them. Praise them for participating in a social activity or enjoyable activity with you or alone. We can help with chores. Chores can be overwhelming during depressive episodes or when experiencing symptoms. So helping alleviate this, and also providing them with that social support, that these things can be done together and not just alone. And being present is one of the best ways that we can show a loved one that we care. So really lending them that shoulder or that ear, and being ever present for them when they need it. We can encourage an individual to seek treatment, to seek professional help that will help them. There are tools in professional settings that can help, that perhaps we might not all have the skills to help them with. And you can also collaborate in that treatment process with them. It's an encouragement, it's a level of support. There are things that, like listed here, that you can do and show up for them with, and plan in treatment with them. So, in summary, depression, like we saw, is common. There are effective tools to treating depressive symptoms and episodes, and CBT is one of those tools. We target these symptoms and episodes through behavioral activation, cognitive restructuring, and experiments like we saw. And CBT is really targeting multiples of the factors that play an important part in the onset and the maintenance of depressive symptoms and episodes. So, an individual's thoughts, behaviors, and their environment. So, we're looking at multiple aspects in that individual's life. So, here are some tips to follow if somebody is feeling depressive symptoms or episodes. So, like I've said many times, being active is very important. Somebody may not feel like they have the energy, or that they just don't want to participate in the activity, but really being active is quite important, even if it's small. We can start small, going for a short walk, doing a task like going to do groceries. So these are all things that can get us out of our house, get us out of our thoughts and those some of those feelings. Seeing other people, being social. So calling somebody, calling a family member, meeting up with somebody simply for a coffee, seeing somebody else, perhaps hearing them, letting them be your external coach, and giving somebody else the chance to be there for you. Uh, More likely than not, they want to support you and be there for you, and want to help, want to find ways that do help you. And the cognitive component here is challenging our negative thoughts. These are some questions that we might use to challenge a specific negative thought. Perhaps we can look at if that thought is 100% true 100% of the time. If you thought of an alternative, or think about a situation differently, when you feel better, will it make you feel differently or better about that thought? Developing the alternative thought. So asking yourself, is there a different way of thinking about this? Would that different perspective make me feel better? Are there some positive things that I'm not seeing, or I'm not paying attention to, that are important here? And perhaps somebody else in that very same situation, they might think differently. So exploring the different ways in which people might think about that situation. And asking ourselves, what would you tell a friend who is having that same thought? How would you reassure them or approach that thought? And on the other hand, if a good friend of ours knew that we were having that thought or that negative thought, what would they say to us? What would their advice be? What would they say differently than what I'm saying towards myself right now? So try to see the positive in yourself. Often we're forgetting to see the positive aspects, or the positive experiences on ourselves, in others, or the world, in our future. So spending more time focusing on those positive aspects than perhaps the negative ones is very important. That coach talk, being kind to ourselves with that coach talk. building ourselves up, having our own back, instead of being a critic or a heckler or negative towards ourselves. Um, there's something to say about being optimistic. And optimism doesn't mean that we have to ignore or deny that we are having negative feelings or thoughts. There is some research to show that even the simple act of smiling, we may not be in a necessarily happy mood, but smiling signals to the brain that there is a better mood happening here. So the behavioral component of smiling can start to trigger that better mood and get us out of that negative mood. And having realistic expectations about yourselves and others. Some of our thoughts may include the words should or must. So I should be efficient all of the time, or I need or must be perfect at this. And really questioning that thought and that should or must. Can it be okay without being super efficient or perfectly efficient all of the time? And uh, not being depressed about being depressed. It sounds silly, but depressive episodes are temporary. They do come and go. And treatments like cognitive behavioral therapy, or even simply changing your thoughts and behaviors around this without therapy treatment, can be effective in treating and preventing relapse from happening again. So there are options about that feeling of being depressed. So I want to thank you very much, and I welcome all of your questions and look forward to having a conversation about depression.